Hi, I'm Dr. Boyce Watkins from YourBlackWorld.com, and you know that I am consistently commenting on what's going on in our community, health-wise and otherwise. And one of the things that some of you may have seen in the media is that the hip-hop artist Lil Wayne has been suffering some seizures. And when the seizures began and he ended up in the hospital, a lot of people said, well, that's what I expected because he uses drugs a lot. He brags about how much codeine he likes to take. Every album he raps about how he stays high and drunk pretty much all the time. And I don't know if that's true or not, but if that is his lifestyle, then it wouldn't surprise anyone that there are long-term health consequences. But then that leads to broader questions. Where do seizures come from? How do you respond if someone around you has a seizure? Could drug use play a role in creating conditions that could cause you to have seizures? So to answer these questions, I went to my trusted source, the physician that I love the most, Dr. Jennifer Caudle, and I've got Dr. Caudle on the line. How are you doing today, Dr. Caudle?
I'm good, Boyce. How are you?
I'm doing very well. Now, you reached out also because you wanted to kind of talk about seizures and really, you know, what they mean, where they come from, how to respond, and now me, I became more interested in seizures when I saw what was happening to Lil Wayne, but you actually made an important point that, you know, these things happen all the time to a lot of people and that a lot of us don't know how to respond when we see someone having a seizure. So first of all, I'd like to ask you, from the very beginning, if I'm with a friend and my friend starts to have a seizure, what do I do? How do I respond?
Well, I think the first thing is knowing what a seizure is. And I think we should first talk about how we identify when someone is having a seizure or not. And, you know, one thing I want to say, too, Boyce, you mentioned that a lot of people have seizures, and I absolutely agree with that. You know, we know that over 50 million people worldwide have epilepsy, which is the condition of having seizures. 1 in 26 Americans will develop epilepsy or seizures at some point. So we know that this is very, very prevalent. But the first thing is understanding, what symptoms a person might have if they have seizures and what causes a seizure. So let's start with what causes a seizure. Why don't we just start there? So I have a question for you, Boyce. You know, let me ask you, do you have any idea, not to put you on the spot or to quiz you, but...
It's okay. It's okay.
Do you, we'll pretend like this is a little game. Do you happen to know, like, what causes a seizure, what's happening in the brain when a seizure happens?
I have no idea.
You have no idea. Okay, so a lot of people have no idea as well. You know, think about a seizure as almost like an electrical storm in the brain. Basically, the brain cells, what we call neurons, inside the brain, they get overexcited. They get completely, totally overexcited, and they become this kind of electrical storm that stimulates different parts of the brain. And that's what actually causes a seizure. So some people are more prone to having these sort of electrical storms with the brain cells. Some people are less predisposed to this. But those that are then often have seizures. Okay. So let me ask you another question. Can I ask another question?
Of course you can.
Okay, good. Okay, so what do you think of when you think of someone having a seizure? What types of things do they do? What types of motions do you see? How would you know someone's having a seizure?
You know, I can't say I know exactly, but, you know, from what I've seen, I would imagine they might fall down to the floor and maybe have some sort of repetitive action, maybe, you know, drooling or just something that lets you know that they're not okay. I see it as something different from, say, a heart attack,
right.
You know, which might have a different kind of response. So I can't say I know exactly what a seizure would look like, but if you showed me someone having a seizure versus someone having a heart attack, I would expect that I could know the difference.
Absolutely. And I think some of the symptoms you mentioned, you hit the nail right on the head. There are many different signs and symptoms of seizures. So everyone who has seizures doesn't necessarily have them the same way. Something you mentioned, repetitive motions. Some people actually have jerking motions or sort of shaking motions. They may fall to the ground. Exactly. They may have these jerking or shaking motions. Some people do have incontinence, meaning they maybe urinate involuntarily during a seizure. Some people don't have the jerking motions at all, though. Some people just stare off into space, and they're not really with it. Some people have other maneuvers such as lip smacking or chewing. They'll just start to chew or lip smack. So there's a wide range of symptoms that people may have when they're having a seizure, but I think that maybe the classic description that a lot of people think of is what you describe as sort of classic falling to the ground, jerking movements. Absolutely. So I think those are two really important things that people need to understand is, how seizures happen, but then how to identify them first of all.
I can tell you this. When I look at, what's happening more publicly as it relates to seizures, I can't help but to be skeptical when I hear a guy like Lil Wayne say, I'm having seizures not because of drug use, but because I'm epileptic. I can't help but wonder if drug use can accentuate some of the things that might already be wrong with us and cause us to, have seizures or some other sort of brain disorder because we're constantly shifting our brain chemistry through drug use. I mean, am I way off with this, or what are your thoughts on that?
No, you're not way off at all. Actually, there's a number of things that can trigger seizures or make seizures worse or make them come more often or come at all in people. There are a couple common triggers. Stress can be a trigger for people with seizures. Can trigger seizures, make them worse, make them more frequent. Also, lack of sleep, can also be a trigger. But you do mention something very important, and that is drugs and alcohol. Now, drugs and alcohol definitely affects everyone very, very differently. But in answer to the question, can drugs and alcohol affect someone's seizure pattern, the answer is absolutely. It absolutely can. So all of these factors may very well play a role into how many seizures someone has or how severe they are, how often they come, the type of seizures they have as well. So they should all be considered.
Interesting. So let me ask you this. So if I see someone having a seizure and I identify, that there's something's wrong, what do I do? I mean, how do I respond? I mean, all I would know to do is call 911 or ask the person if they're okay.
Right.
Are there sort of some standard responses that people should have to that?
Absolutely, and I think your thought of calling 911 and asking a person if they're okay, those are two sort of gut responses that I think are always good ones. When in doubt, always call 911. That's never a problem to go ahead and get help. But there are a few things that we can keep in mind if you see someone that you think is having a seizure. First thing is to stay calm. I think sometimes witnessing a seizure can be very scary if you've never seen it before or maybe it catches you by surprise. You're not used to encountering them. So staying calm is very, very important. One thing you want to do is not to try to prevent the seizure. Okay, you don't want to stop the person from having the seizure. You want to let them seize. You want to let their body carry out this process. And so in doing that, you also want to facilitate keeping them safe. So if a person's on the floor, you want to move away sharp objects, things that could fall or cause injury. You want to make sure that they're safe and nothing is around them that could hurt them. It's often important to turn the person to the side, roll them onto their side so that they won't choke. Sometimes saliva can get to the back of the throat and can cause choking. We don't want that to happen. So if they're on their side, that helps a lot more. You can put a pillow or a jacket or a shirt or sweater or something underneath their head just to support it a little bit. And once again, you want to just sort of be there to support them. Seizures really should last, most of them last less than 5 minutes. So it's also important to keep track of timing. If someone has a seizure for 10 minutes longer, more than 5 minutes, that's absolutely a reason to call 911. And there are other signs and symptoms that really should make you call 911 too. If you're worried about the patient, if they're not coming out of the seizure, if it looks like they're having a stroke, if you're just worried in general, it's never a wrong answer. But those are some things that you can do kind of to keep in the back of your mind if you ever encounter a person who's seizing. Just some do's and don'ts about helping care for them.
Well, I love it. Well, I want to say thank you for your education on this, Dr. Caudle. You've helped me understand how to respond, when I see someone having a seizure. And I also will say that even though I'm not a doctor, I can say, and I assume you would agree with me, that this mass promotion of drug use and the hip-hop industry that's occurring right now is just not good for our kids. One of the things that concerns me the most is that you've got rappers now that rap about this drug called Molly. And, so now kids are using more of it. I have a couple daughters in college, and they've reported that they see their friends using these drugs now more because, hip-hop artists are irresponsibly promoting the use of these drugs and marijuana and alcohol. And I just believe that in general, and again, this is not to say that Lil Wayne's his seizures are caused by his drug use or whatever, but, I just think that heavy involvement in drugs and alcohol can just put you in bad situations, lead to very bad outcomes. And that's why to this day I don't drink, never use drugs. And I'm not bragging about it, but it's just a fact. I don't even want to open a liquor bottle to know what I'm missing, because when I see all the horrible things that happen when people engage in excessive consumption of drugs and alcohol, it literally makes me very nervous. And so I guess, I'll end that by saying that's my position. Avoid drugs and alcohol. Whether the seizures relate to that or not, for Lil Wayne, I don't know. But Lil Wayne's just one guy. I'm talking about the rest of us here. So I want to say thank you for your time, Dr. Caudle. Your expertise has been invaluable. And you're welcome. And to those of you who are listening, thank you for checking us out at yourblackworld.com. And I'm going to keep coming to Dr. Caudle to bring you the information that you need to know. And as you know, Jennifer is an old, respected friend of mine, and she's one of the best when it comes to understanding our bodies and our health. So until we meet again, please stay strong, be blessed, and be educated. We are God.